Today's interview is with Michael Dominguez, the President and CEO of ALHI. So I'm so excited that Mike Dominguez has been able to join us. Mike, you're with Associated Luxury Hotels International, and you have spoken on our NSA stage before, and you'll be joining us at Influence 2020 as well, and then doing one of our breakouts. So thank you for taking a little bit of time right now. What I really wanted to find out right now is how can speakers right now best partner with you? What is some of the challenges that you're facing as you look at this corona virus and how it's impacting our industry? What are some of the things right off the bat that we should know about as we're partnering with our hotel partners and our property partners? How can we help?
Yeah, I think the biggest thing is that we keep talking about the situation is so fluid and the information is flowing so quickly that I think there's an opportunity, especially with the speakers network. How can you as a network kind of galvanize and organize to make sure that you're pushing out a consistent message to the people that actually hire you?
Yeah.
You guys have large databases. you have a large marketing arm. And there are people in the meetings industry, and it's just to keep reminding them and pushing out the information that is to me the most important, the kind that's overlooked with the speed of information that's coming out. And the one thing I consistently focus on, and it's been the highlight across the board. There are 0 travel warnings in the United States from the CDC, the World Health Organization, or the State Department. 0. And when you hear about people not traveling within the US, there is 0 reasons not to be traveling when every major health organization and your State Department is saying there is no reason to stop it. And that's the overreaction that we are talking about within the industry that I think people can help with. That's the biggest piece. I think your network and the speakers network could really help between your LinkedIn and what you do on social media, your LinkedIn pages, your social media pages, and what you're just getting out in pure marketing is to help tell the story. And, one of the things we're talking about is ICA just put out a note this week. The cancellations represent less than 1% of all meetings. And if you pick up the tone in the media, and if you pick up the tone in what has been reported, and I should say the mainstream media, when you pick up that tone, you would think business has halted. And that's just not the case. Certain companies are making decisions. They're big names. They're large audiences. And they're canceling, and that's what's kind of monopolizing the headlines. And what we're trying to do is get underneath that and said, okay, for every cancellation of a large Google conference or Adobe conference, literally there's 19,000 meetings that are happening between February 1st and May 1st that haven't canceled. And those are the pieces of the story that aren't being told. Everybody thinks everything's shutting down. I think it's really telling if you notice the largest meetings that have been canceling in any kind of number is technology. I think it's twofold. One, technology is more global, leans into very much an Asian presence. And Asia is still the hotbed of where this is a challenge. And then on the top of it, look, tech is going to get killed in Q1 and Q2. So the supply chain disruption is going to hamper their production over the next, literally 60, 120 days. I'm not completely convinced that some of this isn't as well financial. That how do you buckle down knowing that you're going to have a bad quarter and a half? And I'm not faulting anybody. The one thing I've been mentioning is the responses, the needs, they're all individualized. And you have a lot of risk managers and a lot of lawyers in these companies that are talking about the risk. And I have heard this from people that their lawyers and the risk managers are telling them that there's liability. How can there be liability when there are 0 travel warnings to travel anywhere? In the US, I'm not putting this as a blanket, but even when people say, well, international, there's only 4 countries internationally that have any kind of travel warning. It's not all of international. And we know enough about geography when we're hearing that there's an issue in Italy that we think Europe is the problem. No, Italy is the problem, not Europe. There is an issue in northern Italy that has actually spread through Italy. But when I talk about perspective and context, there are 3,000 cases in Italy currently. There's 60 million people that live there. it is such a small percentage of the overall population. And I think that's where you and your network can help to tell the story. Can you tell the right story to say, let's talk about even the 100,000 people that are now, the 100,000 cases that we have now reported worldwide. We have 7.7 billion people on the planet. It's 100,000 people out of 7.7 billion. That's just not being put into perspective enough. And that's my challenge, is that I think there's not enough information that's coming out. And the problem is mainstream media keeps telling you how many cases. Today was the report, we're at 100,000. They're not telling you how many active cases, which are literally under 50,000, because 55,000 people have already recovered from the disease out of the 100,000. That's the more important number. There's only 40,000 active cases in the world, not 100,000. But that number is always going to look larger. That number is always going to get bigger as that you have new cases. But 80% of all of the cases with COVID-19 are listed as mild. It means you have a cold. That's what it's going to feel like, and they fully recover. The risk is the same risk we have with influenza. Although there's some exceptions, what they're finding is if you are healthy and under 50, you have nothing to worry about for the most part, and your risk is very light. If you are over 50 or you have a chronic medical issue, you are at higher risk of actually moving into a critical category if you catch the disease. That is very much like influenza. But when I say it's different, you know what they have found? It's not impacting kids, and it's not impacting women that are pregnant. Now, influenza, those are high-risk categories. They're not high-risk here. And then I think in the headlines, we take the pieces we want to, and we don't listen to the other pieces of it. So the head of the World Health Organization also said, this is an unusual pathogen, respiratory pathogen, because they're actually able to contain it. And his point was, if this was influenza, you would have a pandemic around the world and an epidemic that they could not control, because you can't control influenza. So that's kind of lost in the story, that this is able to be contained. And that is the important part. I think the other part that you can really help with, because this is now the new emergency, every time a state declares a state of emergency, we're now having people saying, I can't have my meetings. A state of emergency is procedural, and what most people need to understand, it's all about dollars. When they claim a state of emergency, the issue and the reason they are stating a state of emergency is now they can apply for federal funds. And if you pay attention, Congress just passed an $8.3 billion fund that the president just signed into law today. Well, that funding is now eligible for all the states that have claimed for a state of emergency. When they start moving resources, when they're trying to get masks, when they're trying to get testing kits, the state will be able to get reimbursed. That's why they talk about a state of emergency. And Governor Newsom, in fairness, he tried to say that in his press conference when California claimed a state of emergency, yet nobody reported that. You get the headline of California, actually calls for a state of emergency. That doesn't mean there's an emergency, and those were his exact words, that it was procedural and it's getting prepared. I think that's where your community can help to get the word out, because you have a network. And I think part of the issue with the speaker community is the same issue we're having within our hotel industry and the meetings industry. We're trying to say everybody's talking, but because we're not on the same talking points, nothing's getting through. And I think it's important that as a speakers organization, how can you guys unite to say, here's our talking points for the day. Can everybody get it out through your network? And the next day saying, here's your talking point. Can everybody get it through the network? It's the only way we're going to be effective. Thank you.
Thank you. Tell me a little bit about some of the things when we come on property with you. So we're coming on and we are enroll. How can we support you there? Are there things that you've put in place that are proactive, that we could be good role models around safety behaviors, that we could be good at pointing them out and supporting you, whether it's the sanitization stations, whether it's making sure that when we network, we aren't shaking hands, that we've got, we're doing transactions, whether it's, people buying our books and we're doing those virtually without touching us. Are there some things on site that we could be good role models for as well, that partners with the hotels?
Yes, but I also want to mention, all the health leaders, whether it's CDC or WHO, they will tell you this is very hard to get. It is not easy. That's why the numbers are very small as an overall population. You have to be in close contact. It is not airborne. it actually is passed through droplets, which means you have to be within, and they always say keep six meters between you and anybody who's coughing or sneezing, because it's the droplets that will be impactful. And yes, those droplets could end up on somebody's hand. The droplets could end up on a surface. But the point is, don't touch your face. Don't touch your eyes. Get out of that habit and wash your hands. You know, and it was interesting because washing your hands is still the issue. And when I travel, I've been doing that for a long period of time. And I think it's one of the reasons I don't get sick. I wash my hands to the point that I have to lotion them because they're drying out because I'm washing them so often. But that's what we should be doing, whether it's a flu epidemic. You know what I think is going to happen? I think you're going to have a lower case of influenza from here on out because of what everybody's doing to try to protect themselves from COVID. But it's influenza that you have a higher risk of actually catching than you do, you know, the COVID-19. So that's the issue. And what you just said, I just spoke this morning to a conference that's here at Bellagio. And what I think is really interesting, it didn't go through my head that somebody is handing me off the advancer that they had, and I didn't sanitize it. I didn't pull out a wipe, but as soon as I was done, I went and washed my hands.
Right.
And I still shook hands. I'm not going to stop shaking hands, but what I've always done is when I shake hands, I go wash my hands when I'm done shaking everybody's hands. I think it's overkill. I really do. But if you're going to try to be safe, then yeah, don't shake hands. Let's all be Japanese and we'll bow. And then we won't have to go that route. And I get that. And but to me, it's an overreaction to something that, okay, if you really believe that we're in the highest flu season we've ever seen, you should have been doing that already because of influenza. And you don't do that during flu season. And, you know, we keep talking about more people will die from the flu than they will ever of this disease. And more people will contract the flu than they will COVID-19 by millions and millions of people, yet you don't change your behavior for that. And that's where I think it's overkill. When you have one case reported in the state of Nevada, I have to be the unluckiest person in the world if I get COVID-19 because I shook somebody's hand at a conference that's here that doesn't even live in Nevada. I mean, that's where I just think it's an overreaction to what's really happening when you look at a percentage of the population and what it means. And I actually posted something from a doctor that was quite brilliant. The cases of COVID-19 are actually your chances of getting it are 1 in 100,000. Your chances of being struck by lightning are 1 of 3,000. And we're not talking about that. You have a better chance of getting struck by lightning than you do of catching this disease. I would say where you can help is not to overreact, not to freak out, to act like things are normal. And yeah, if you're doing a book signing, do the book signing and then go wash your hands. That is the point to it. And you say that, but if you're I guarantee you're not doing this. You're going to check into the hotel and they're going to take your ID and your credit card. Did you just go wipe that down because somebody just touched it? But that's what I mean, that everything we do, somewhere you were touching, but yet we're saying, okay, we're at a meeting or we're in an airport or we're on a plane and I got to completely change my behavior.
Right.
I will tell you, you know, I had an employee, not at the hotel, but at a place I was visiting, and literally the employee was sick and they were coughing and sneezing. You know what I did? I literally took my credit card afterwards and I did go wipe it down because I go, that person was coughing and sneezing, and I don't know if it's just a cold or a flu, but even if it is, I don't need the cold or the flu. Whatever it is, I don't need whatever you got. But that is kind of the point.
All of these practices are going to keep us healthier across the board, not just around COVID-19, but they're going to keep us healthier as we travel, because flu is out there too, and influenza is out there too. So it is all of these practices that we're ramping up now because of this particular reality is something that keeps us across the board better practices and healthier.
And probably the biggest message you can help get out is everybody needs to quit buying masks, because the healthcare professionals that need them aren't going to have them if there is an outbreak. And most importantly, all doctors will tell you the people that should be wearing masks are people that are sick. If you're coughing or sneezing, you should be wearing a mask. This is not an airborne virus, which means you have to be able to catch the droplets so you can wear a mask, but the only way you're going to get that unless you're within 6 feet of somebody coughing is that somehow those droplets are on the surface you're touching. The mask isn't going to help you. That's the point. and you're still going to rub your eyes or you're still going to touch your face. And, you know, it's funny, was watching Jimmy Fallon last night, and they told him not to touch his face. And they counted the number of times he touched his face the night before, and it was like 17. And he was making a joke about it, that we all touch our face. Well, the idea is then wash your hands.
Yeah.
And I just hope everybody washes their hands when we're past this emergency, because we should be washing our hands that often to begin.
Right. Keep it. I was at the National Speakers Association Winter Conference this last weekend, and in the restroom, I kept hearing people singing happy birthday, because the recommended amount of time that you should be lathering and washing is, and I was like, I feel like I had so many birthdays during Winter Conference. The amount of people singing happy birthday in the restroom, in the ladies' room, as they wash their hands. So I think that that's a good practice. If we all sing a little more happy, a little longer hand washing, and spread the news, that'll be good.
That is it. And it really is. Like, you know, make sure you have hand sanitizer around. If you can't, hit a washing station. Wash your hands as often as possible. And here's the most important message for everybody. If you are feeling sick, get out of the way of everybody. Go lock yourself in your room if you're feeling sick. Even if you have the flu, it is a good thing. Don't come and try to be a soldier, because all you're going to do is infect other people. And that's well past COVID-19. That is just really good practice when you're traveling, and really good practice as a compassionate human being, not to try to infect everybody.
Very good. Well, Mike, thanks so much for taking time. I can't wait to see you at Influence 2020 in Washington, D.C., August 1st through the 4th.
Yes, ma'am. I'm looking forward to it. And thank you so much. I really appreciate the time.